A GMTV survey has revealed that 1 in 4 women want to have cosmetic surgery on their stomachs. But what is the reality of getting liposuction? And is it really possible to get it in your lunch break? Well, 40-year-old Jackie Barker felt that high-definition liposuction was her only option after failing to get rid of her mummy tummy.
My tummy was very, very toned due to doing 200 sit-ups a day because I had the time to do it. And I was very, very proud of it. And then I hit 35 and all of a sudden it didn't seem to take an awful lot for me to put on weight, and in particular around my tummy area. It's like having a little apron. It's like a little pad that hangs over everything and there is nothing you can do. You can't even suck it in. My hopes are that, although I'm aware that I'm not going to be Kate Moss at the end of it, that at least I will have a stomach that I can be proud of, that I'll be able to wear the clothes that I want to wear, and I can just be confident again, just have that confidence back that I had before.
Okay, so Jackie, you've come in today, you're unhappy with the state of affairs of your tummy, and we're going to fix that, okay? What I propose is that we firstly take away a lot of this fat, debulk it, so shrink the size of your abdomen. The high definition part of this procedure is where we actually start chiseling around your muscle structure underneath, okay? The ultrasound is very liposelective, targets the fat cells, leaves the other stuff alone. This is blunt. The machine's on at the moment, it's not doing anything to my hand. So you can go right down over the top of the muscle or very shallow to the skin and achieve really good results without the risks that are involved in normal liposuction. We're now removing the fat that we've emulsified. So already, even though we're not quite finished and there's quite a lot of swelling already, you can see the shape taking place. I think you should be quite happy with the results.
Feeling a little bit sore, a bit tender and slightly woozy. However, I can already see a difference, even though I've got this massive compression garment on, and I cannot wait to see the end result.
Well, Jackie and Dr. Hilary join me now, and you are happy with the results?
Delighted, absolutely delighted.
How long did it take you to have to get that corset off? How long did you have to wear that?
6 weeks, 6 to 7 weeks.
That's a long time, isn't it?
It feels longer when you're in it.
I bet it does. You have to wear that all the time, even at night?
All the time at night.
It's uncomfortable, wouldn't it? Trying to sleep
It is uncomfortable. You get used to it.
Right.
And obviously, as time goes on, you get smaller, so it gets more comfortable.
That's because the bruising and swelling is going down?
Yeah.
Pain-wise, how painful?
Very painful initially, you know, the first couple of weeks, and you're draining fluid, because obviously they put fluid in, which has to come out. So initially it's quite painful.
Right.
But again, it's like anything, you get used to it. You obviously have painkillers as well, so...
Compared with childbirth, how painful was it? No, it wasn't up there, was it? OK, fine. I just wanted to make that point. But for you, do you feel more confident now? Do you feel better?
Absolutely,
right.
100%. Yeah.
Because we can see, I mean, you very bravely showed us, you know, obviously we saw there what you were like before. You were like so many women. I've got it as well. We've all got, you know, little tummies. We all have that. But let's have a look at before and after. We can see that is quite extraordinary. That difference. And has your skin all kind of tightened up? Are you doing exercise as well?
You have to really embrace the whole of the aftercare section.
Yes.
You know, and they do like spa RF treatments and ultrasound, which help tighten everything up.
Right.
And again, you know, you have to make sure that you look after your diet as well.
Yeah, so this is a commitment. You can't go back, because the thing is, doesn't the weight might come back, Hilary? It might come back somebody else.
Yeah, absolutely.
Which is a bit worrying.
Jackie's results are fantastic, I have to say, but they're temporary unless she keeps working at it. So it's a kick-start.
Yes.
You get a great result, and for many women, they say, right, I'm going to keep this now. I've invested a lot of money
and a lot of
in
pain
this procedure,
and time and all of that.
And now I feel so much better about myself. I can go to the gym, I can do this, I can do that. That's all very well, but, you know, of course there is a downside. First of all, it's very expensive.
How much is it, just about?
About £9,500. My treatment, obviously, it's different for whatever you have done.
£9,500?
Yeah.
Gosh, that's an awful lot of money, isn't it? It's an awful lot of money. And there's the 6 weeks in the corset, and there's the pain.
There's a huge... I mean, this is not a dinner-hour operation. This is,
not at
you know,
all.
5 hours on any operating table carries risks.
See, I think sometimes you watch all these reality shows, especially the American ones, and they make it look like nothing. They just make it look like it's absolutely fit, and it's not. It can be really, really dangerous.
Absolutely. Well, I think most of us are aware of Denise Hendry's plight, and she lost her life as a result of complications occurring after cosmetic surgery, liposuction, in fact.
Yeah.
This similar kind of procedure. I think also it's important to realise that you can get deep vein thrombosis. You can also be disappointed with the results, you know.
Right.
I mean, you can have a slim tummy, but everywhere else looks the same. So you can end up looking out of proportion unless the surgeon talks you through it first and says,
Right.
this is how a computer image would see you afterwards. You have to bear that in mind. And the fat can come back unless you're careful. So,
does it come back to the bit where it's been sucked out?
oh, it can do. Yes, it can do.
Really?
It'll reform.
Right,
Yeah,
okay.
absolutely. So these things need to be borne in mind before you make that commitment. Find a surgeon that is reputable, that your doctor recommends, or you find who is with an accredited group of cosmetic surgeons with experience. Talk to his previous patients. If he doesn't let you do that, there's something dodgy going on.
You'd be worried then. I mean, you did a lot of research, didn't you?
Yeah.
You made sure, because you don't go into this lightly,
Absolutely
for goodness
not.
sake,
And,
you
know,
wouldn't.
you are spending money, and you've also got to make sure that you're confident with the person that's doing it for you.
Definitely.
So I think that's really important to make sure you do your research.
It's worked for you,
Yeah.
but it is not. This is not a surefire success, and you
Absolutely.
have to now keep working. You
Yeah.
have to
Yeah.
exercise and eat properly and look
Yeah.
after yourself.
But as you know, it's a starting point.
Sure. Thank you.
Try some skating on ice. That really helps you lose weight.
He's fading away.
I'm wasting away.
He's a mere shadow of himself. It's the nerves as
But
well.
It's good fun.